scanning the room.
Hello, my name is Joyce Jones, and today I will be demonstrating IV therapy. So to get started, I have performed hand hygiene. I have obtained my doctor's orders and the MAR, and I'm just going to verify as my first med check that everything matches up. So I have Shirley Koss, 4/3/1987, and Shirley Koss, 4/3/1987. We see that the doctor has ordered lactated ringers, 150 milliliters per hour via IV. And so that matches up with my MAR. And so now I'm just going to go into the patient's room. I'm going to introduce myself to her, verify her name and date of birth, and talk with her about the IV initiation. So I perform hand hygiene. I walk into the patient's room, and I'm just going to verify. Hi Shirley, my name is Joyce. I'll be your nurse. Can you verify your name and date of birth with me? We have Shirley Koss, 4/3/1987, and that matches up with my healthcare providers and my MAR. So Shirley, we're going to get ready to start an IV. I have verified that you have a need for that IV. So have you ever had an IV before? She says yes, she has no questions. Okay, well I'm going to go get my supplies and I'll be right back. So I'm going back to the med room. I perform hand hygiene, and now I'm just going to do my second check by gathering all of my supplies. So, we have Shirley Koss, 4/3/1987, and that matches up with the MAR, and I have lactated ringers, so I'm just going to go ahead and pull that out of my Pyxis. And this bag has not been tampered with, it is not open, and it is not expired. Okay, the color and clarity looks fine, and we have lactated ringers, and that matches up with my healthcare providers and my MAR. So then I'm just going to gather all my other supplies. I have my primary tubing and all my other supplies. I've double checked all these supplies and none of them are open or tampered with. So now I'm just going to take all that to the patient's room, and I'm going to perform hand hygiene, put on some gloves, and I will start with my third med check. So I'm just going to verify my patient again, verify her name and date of birth, and it matches up to my healthcare providers and my MAR. And I will again verify that lactated ringers. So I have my lactated ringers. I will go ahead and open that. And I'm just going to double check that the color and clarity is fine. Squish it around a little and make sure there's no tears or leaks. And there's not, so we're going to go ahead and get started on that. So I need my primary tubing. And I'm just going to open this up. This has not been tampered with. It's not expired. It's good to go. And I'm just going to get started by spiking my bag. I have put on brand new gloves. And I am going to spike this bag. I wasn't right-handed. Ooh, that would have not happened. But this is an old bag, so. Okay. Now that I have spiked it, I will just press the drip chamber halfway, and before I spiked it, I made sure that my cassette was closed. So now I'm just going to invert that and open that up. Wait for Minnesota to fill, and then I will invert again, and being careful not to touch the tip of this. I will let it drip, checking the full length of the line to make sure that there are no bubbles. And if there were, I could just kind of work the tubing to get that out. So I don't see any bubbles, so I'm just going to go ahead and place the cap back on that and close my cassette. I would place this into the machine and set that at 150 milliliters per hour. Okay, now what am I going to do with this? Okay. All right, so then I will now get ready to do my saline lock. I will also, before I do that, put on my label on my patient's medication, and I've already double checked that this label matches with my healthcare provider, my MR, and my patient's name. I will also put on a label on my tubing that tells me when this tubing was put up, my name, and the kind of tubing it is. And so now I will go ahead and get started with my saline lock, my extension tubing. So I'm just going to put on some new gloves and open this. And this has not been tampered with. It's absolutely brand new. It's not expired. And I have my saline, same. It's not open. It's not expired. Okay, I'm just going to prep this by taking the cap off. I'm just going to pull back slightly and then just release that pressure. And then I'm going to place that cap back on there. So I'm going to be careful not to touch the inside of this wrapping because I plan on using it to put the saline lock back in. So I'm just going to take the cap off and prime this tubing. Ow. Maybe. Okay. So I'm just going to go ahead and prime that tubing, making sure not to touch the tip. There are no bubbles. And I'm just going to place that back into my sterile package for later. Okay, I'm just going to put that in arm's reach so that I can reach it. And now I'm going to get my start pack and my needle. I'm just going to go ahead and open this. It hasn't been tampered with. I'm going to apply brand new gloves and get my tourniquet out. So I'm going to go ahead and place the tourniquet under my patient's arm to palpate for a good vein. Okay, and so I performed hand hygiene, I put on some new gloves, and I'm just going to palpate and make sure that I can see a good vein. And I see this one looks good here, so I'm just going to go ahead and release that tourniquet. I will take my ChloraPrep that is not expired and not tampered with, and I will open it if I can. There we go. I'm just going to pop that. And for the sake of the video, I'm not going to rub it for the full 15 to 30 seconds, but I would rub the area for 15 to 30 seconds, and then I would let that dry fully before I continue. So I'm just going to get the rest of my stuff ready while that dries. Okay. So, now I'm just going to place the tourniquet back on my patient's arm, and I have put on my gloves. I will go ahead and do that before I do this actually. Okay, so I will go ahead and put on my gloves. And then I'm going to apply the tourniquet and get ready for insertion of the catheter. Okay, so I can see that it's nice and strong there, that vein. I'm going to go ahead and open my 18 gauge catheter. I'm just going to take the top off of it. Okay, and I'm just going to loosen the hub of this slightly, and I want to make sure that I use bevel up. So I'm just going to anchor with, I'm going to pull the skin taut, and I'm just going to go ahead at a 10 to 15 degree angle. I'm just going to advance that in until I see a flash of blood. And then I'm going to go ahead and put that in another 2 millimeters, and then I'm going to lower the level of that catheter, advancing the catheter while I pull back the needle, which is not being my friend. That explains it. Okay, not working out to my advantage. Okay, and I'm just going to activate the safety on my needle. I don't know why it's not doing it. Okay. Okay, so we're going to get that all the way up to the hub, activate that safety, and I'm going to occlude the vein and pull that out. That's going to go in the sharks. And I will take this tourniquet off. Now that I have occluded the vein, I'm going to take my saline lock and attach that to my patient's arm. Okay, and I'm just going to go ahead and anchor this down with a piece of tape. Okay, and I'm going to go ahead and flush that and make sure that it is patent. And okay, that looks good. I'm just going to leave that there, and I'm going to put an occlusive dressing over it. Okay, and now that that is done, I'm going to stabilize the rest of my saline lock. I'm going to be careful not to touch this hub onto anything. I'm just going to stabilize that right there. And I will get ready to connect my primary tubing. So I haven't touched the end of my primary tubing, so that is still sterile. So I'm just going to pop the top off of that and attach that to the hub of my saline lock. Okay, that would obviously stay a lot more reinforced than it is. Right, and so I will reinforce that a little farther up my patient's arm, closer to the IV. And I will document what I did, where I put it, the size of the tube. I will put a label on the IV site, close to the IV site, and I will document assessment of the site, the type, length, and gauge of the tube of the needle that I used, and then I will leave the room. So now it's been a little while, and my doctor wants the saline lock discontinued. So I would go through the verification steps again. I did hand hygiene before I left, and I've got new gloves. Did hand hygiene before I come back in, and so I'm just going to verify that it Shirley Cos 4/3/1987, and I've asked for that and verified it with her wristband as well as on my MAR. And so now I'm just going to get ready to discontinue that saline lock. So I have brand new gloves, and this arm is not cooperating with me. Okay, so okay, first I'm going to just make sure that I take off, I'm just kidding, I'm going to lock this thing on the primary tubing, and I'm going to go ahead and turn off the pump, and I'm going to get ready to discontinue that. Get ready to discontinue the primary tubing in the solution. So, okay, I'm just going to discard this appropriately, and I'm going to go ahead and clean the hub of my extension tubing, just for safety measures. Should have opened this before I did that, but that's okay. My saline was not tampered with or opened before. I'm just going to pop the top on that, break that seal, and okay. And I did move my hand off of this, so it's still clean. I'm just going to go ahead and flush that tubing, making sure to assess if for any infiltration or pain, and my patient is verbally telling me that she has no pain. So I will just go ahead and take this off, and I'm going to lock the clamp, and then I will get ready to take off the tape. But this tape is all messed up, so I don't know that I will actually be able to get it off. All right, so I'm just going to start on this side, and I will take all the tape off, making sure to hold the hub of the needle so that it does not come out or wiggle around at all. Okay. And so, like I said, now we're going to be discontinuing this saline lock. So I've double checked my provider's orders, and I've done everything, all my safety or medication checks with provider's orders and with my patient before I took this off, apparently. And now I'm just going to discontinue that saline lock. So I'm going to hold on to the hub, and I'm going to just add pressure to the site, and I'm going to pull straight back on that needle, and that is going to go into the sharps. But before I put it in there, I will inspect the tip of the catheter and make sure that it's intact, and then I will put that in the sharps container. And I will just hold pressure here for about 30 seconds, and then I am going to assess that site one more time. And I'm going to have this tape act as the bandage for me. And I'm going to tell my patient to leave that on there for a few hours because this is a pressure dressing. And so then I would wash my hands, clean my station, document assessment of the site, date, time, my initials, discontinuation of the saline lock, and I can't remember what else, but, oh, and the insertion of the needle and what size and length and location. And that's it.